Okay. Hi, everyone. Thank you so much for joining us. So today we are going to hear from our two wonderful guests about some of the challenges that kids in North Carolina face as they try to access care for complex behavioral needs. So I'm Clarissa Donnelly-DeRoven. I'm the Rural Health and Medicaid reporter here at North Carolina Health News. We are a nonprofit, and so it is super helpful if any of you would like to donate to help support our work, to do events like this, and to do stories like the ones we published about this topic. We had one that published this morning and then one that published on Tuesday. So if you can donate, you can there should be a link in the chat box coming, and you can also go to our website and there's a big red donate button. So with that said, we can get started. So our two panelists today are Joonu Coste and Delia Bailey. Joonu is an attorney at Disability Rights North Carolina. She's on the investigations and monitoring team. She focuses on children's access to behavioral health services and the state's over-reliance on institutionalization. And Delia is the parent of a child who has complex behavioral needs. And in that role, she has spent the last half decade, figuring out how to navigate this system and advocate for her child, among other things. Delia, could you start us off and just tell us a little bit about your journey and your son's needs?
Yes. Well, my son has been quite a character since he was very small and a little difficult. I did not realize that his difficulties would become a problem until he was in about third grade, when his behavior started to escalate, and I started trying to find help and navigate the school system with him. Um, at that time, he had some serious issues and ended up hospitalized at a psychiatric short-term care facility. I'm not going to say which one. And he ended up twice inpatient when he was quite young. At that time, he was on private health insurance, and it was recommended that he have a number of services such as day treatment, intensive in-home, etc. However, a lot of these services were not available to us because there are no providers for non-Medicaid services, and we did not qualify for Medicaid. Had insurance through my husband's work. This continued. I started working with the school, trying to get IEP testing, etc. And sadly, my child did not cooperate with the IEP testing, so they gave up and stated a 504 plan and told me it was pretty much the same thing. And I found out later it was not. He also then was lucky to get the one spot in day treatment through the school, which is run by an outside agency. He was able to get a spot in the day treatment that was the only spot for a child that did not have Medicaid. So we had to go on a waiting list and then get into that program, which was he would go there instead of school, and it was in one of the schools, and then he would come home in the afternoons. And that went okay. He was very resistant, but once he finished that program, he returned to school and had several successful months. However, he was not on an IEP and was not able to have intensive in-home or any of the other services recommended to help him continue his progress and integrate into the school system appropriately. So around about the late fall, December, he again had an incident, which happened to be in the gym with the entire school present. It was quite spectacular. So at that time, he was then put on a reduced school day by the school of 2 hours, and then the pandemic came upon us. And so all the progress he had made was then pretty much gone. Um, he was at home with me for the entire pandemic until school started going back in person. And then we tried to have him go when it was like 2 days on, 3 days off situation. And of course, he had not been in a regular school environment more than a few months in a couple of years. So that didn't go well either. So I put him back on virtual. But during the time that he was in the school, there were some incidents, and the school decided to then pursue legal charges. My child was not on an IEP at the time, so some of the protections of the IEP were not in place, um, despite the fact that he had known disabilities. So over the summer of 2020, I believe it is, we were then able to get um, autism testing done, all these things, because my husband had lost his job and gotten laid off during the pandemic. So then we got Medicaid, which was a real life changer. So there were all these things we were able to start doing over that summer, including completing autism testing, all these diagnostic tests and things, and get him on an IEP before school returned. And he was doing really well in school when he returned until there was some issues with, um, they showed the 9/11 video to the kids. Then they had an active shooter lockdown drill the same day. And he sadly made some inappropriate comments about guns and bombs, and then received further charges. And then it became this really difficult situation with um, BJJ involvement. DSS did an investigation, and all they said was that he was underserved by the people that were supposed to be providing him assistance. So we went through this whole situation. Then I found some advocates to assist me, including Disability Rights in North Carolina, and I was able to get a lot of testing done with the Medicaid that I could not have afforded otherwise. We were able to get a round of intensive in-home. We were able to get gene site testing, which is a psychopharmaceutical testing, and found that he was on the wrong medication, et cetera, et cetera. He's starting to turn the corner now, and hopefully he can sustain while we try to continue finding the right services for him. But the autism diagnosis did not come until August of that year. So he went a number of years in school. And since he's high functioning, everybody would say things like, well, he seems so normal. And then they would try to treat him exactly like the other kids. And when he would get overstimulated and start to have a meltdown, here we go. We've got 4 police officers and 3 school officials chasing him around the hallways of the school. And it was quite difficult. So he at the time began having a lot more anxiety and difficulty due to all of the legal involvement, etc. So during the time when he was probably at his most vulnerable and we were trying to get him the most services, now we also have all this extra pressure and stress added of all this legal stuff. And he was convinced in his mind that they were just going to lock him up, throw away the key. So I had to really fight for him. I had to go into court several times and plead with the judge to do things differently than they were trying to do, because as a child with autism and behavioral issues, we don't really want him to be doing community service necessarily, or to be forced into residential care when really it's not the right time. He may be able to avoid it, etc. So I really had to fight. I had to dig around for all the resources I could. Luckily, there's some resources that are free to parents through First for Families and Children. They have parent advocates. Disability Rights in North Carolina has attorneys that work with parents with IEP and school issues, as well as Medicaid and different things. We were able to get a healthcare coordinator through Via Health, which is only available if you have Medicaid. And we were able to get all sorts of services. And I can happily report that over the past couple of weeks, this hadn't been a long-term change, but I've seen a lot of improvement and growth in my child. And I'm just really grateful to all the people that have helped us. And I'm also grateful to Clarissa, who has been writing a story on our case, because she actually came into the courtroom with me several times and sat with me, and it was really stressful. So having her there was really supportive, as well as wanting to be able to share my story with other parents so that they don't have to go through quite as much difficulty as I did. That's about it.
Well, thank you so much for sharing that. So to go to you, Joonu, could you help contextualize Delia's story? How common are things like this? How many other people are struggling with this? How many kids are going through this? Tell us a little bit about the legal landscape.
Sure. And just thank you for having me today. Can you hear me okay? I just want to make sure my speakers are okay, good. Thank you so much for having me. It's a privilege to be here with you, and to just support Delia in sharing her family's story, support great journalism, and to be here with all of the people watching. So first, I just wanted to emphasize one thing that Delia said. Delia, can you just emphasize what age your son was at when he finally was properly diagnosed with being on the autism spectrum?
12.
12. Okay. So I just want to emphasize that, because that is very common. What Delia has been sharing with us is the normal story that I hear once parents and guardians get to me. Once I encounter a family, this is the common story, the common trajectory. And just to think of being a young person, not having the proper understanding of oneself and context for oneself and tools to advocate for oneself, and how frustrating that is. And of course, a child in that situation is going to demonstrate behaviors that are challenging, because behavior is communication. And to think of all those years that the family struggled to support their child, again, being deprived of the proper input, and then all of the years of potential intervention missed for that child and that family, where her son could be in a completely different place developmentally today, if he had had access to various interventions and therapies and tools along the way. So I think it's so important to first emphasize that we have a significant problem with identifying children in our state with developmental disabilities and intellectual disabilities. And then when you layer on top of that mental health challenges, be it trauma that many children experience in the home and community, or just simply the trauma of being a person with a developmental disability trying to navigate the world that is continuously making you wrong everywhere you go, and that is completely sensory overwhelming, that is enough to induce mental health challenges in any individual. That this is the norm in our state. And instead of addressing that issue of identifying and providing the services, the system as a whole tends to gaslight the parents and the guardians, which isolates families, which isolates the children, and just reinforces a cycle of stigma.
I'm gonna interrupt real quick and tell you that
you go right ahead.
even at one point, there was some law enforcement present, and even one of the officers said to me, "Well, your child's problem is that you never properly disciplined him over the years, and you better start, or he's gonna end up in jail." That's what the law enforcement officer
Yes.
told me at one point. And I will also say that, yes, I was trying to get all this help and services all this time. So it's not a matter of not making the effort. It's a matter of it's just not even available.
Absolutely, Delia. And to your point, you know, I've had folks tell me that they've been in parks with their children having meltdowns, and people have offered to take off their belts so that they can spank their children right then and there for apparently the group satisfaction. So people can be really insensitive. And that's what so many families and kids are up against, is this misapprehension in our society as to what behavior is communicating. So I just really just to support, you know, what you have so eloquently shared, I have basically kind of 3 points that I think will provide some legal context. And first is just to acknowledge that our system has had fractures in it for a long time, and the pandemic has just really brought them all to the foreground. And we've seen a huge increase in children who were maintaining before the pandemic, and then when services stopped, once access to schools and all of those resources stopped, children have gone into crisis. So right now we truly are in a mental health crisis for children in our country, and our state is reflective of that. One aspect that many people do not understand is the distinction between private insurance and Medicaid coverage. And Delia's story speaks to that. Most people assume that when you have a private health insurance coverage, that you'll have access to all the services that you or your child needs. And that's just not the case. Private insurance is a contract that you sign with your insurance provider, and that defines how you can resolve disputes, what services are available, and also defines access to those services and how much you're going to have to pay. And historically, there's been a divide in health insurance around physical health, mental health, and developmental disability. And if you have a child that breaks their leg, you have no problem, for example, getting them into occupational therapy with private insurance. But you have a child with autism who also needs occupational therapy, it can be much more challenging, and you can face many more obstacles because of the way that the laws are written and the contracts are written.
I'm going to interject again. The autism testing is somewhere around $2,000 or more. It is not covered by private insurance.
Correct.
The therapy, private therapy, is covered at 50% at most private insurances. So if your child needs therapy, you're probably paying at least $50 a session, as well as psychiatric care. So every time my child needed a counseling appointment, I either had to beg the counselor for a discount, or we were on maybe a once or twice a month therapy sessions because that's all we could afford. And seeing the psychiatrist every 6 months, and even finding a psychiatrist to help who took private insurance for children was a challenge. There's only a couple, and I had a very bad experience with one psychiatrist. So yes, there's a lot of holes in the system. But when we got the Medicaid, I was amazed at how many things immediately became possible. And having the healthcare coordinator from ViaHealth, with a parent who's dealing with a child who's got explosive anger and different problems that I'm dealing with on a day-to-day basis, I've had to sit on the phone sometimes 7 hours in one day trying to get help for him. So having a healthcare coordinator who can help you find the services you need, even if they're not available in this county, has been a deal changer as well.
Absolutely. And I think that just, that speaks to the issue of private insurance is even if you have private insurance, even if you can afford the co-pays, the co-insurances, and sometimes just to pay completely out of pocket, attempting to find a therapist in the state that has an opening and will treat a child, for example, under the age of 13 is a huge challenge. And many parents are reporting wait lists of 8 months to a year. And then in addition to that, to try to find a practitioner that is competent in working with children with developmental disabilities is a further hurdle. So there are many challenges to access across the board, whether you're in private insurance or Medicaid. However, the difference is that with Medicaid, there is a federal provision so that when you have a child who is enrolled in Medicaid through a program called the EPSDT, it's called Early Periodic Screening Diagnostic Treatment, there is a legal right to get the treatment. So this is a comprehensive and preventative health service for children, anyone who is under 21, who's enrolled in Medicaid, and it provides for preventative dental, mental health, developmental, and specialty care services. So if a child becomes enrolled, as Delia's son was, and of course this is a program for families who are low wealth families, so you unfortunately have to wait oftentimes until a parent loses a job, which is altogether too common in this situation, or is working in a job that does not pay a high wage in order to be eligible. But once that's triggered, if the services are denied, there is a legal remedy that you can pursue. You can pursue an appeal with your MCO if the service is denied. And if the services continue to be denied, you can actually take your dispute to the administrative court. And that's the distinction between the two forms of insurance. And that's what allows organizations like mine at Disability Rights to be able to advocate for the children, because it's not a right of the parent, it's a right of the child themselves. So we can take those cases and we can advocate strongly that the child needs the service, both to make improvements, which is considered a habilitative service, or to prevent regression, meaning if you stop the service, then the child loses progress. So if either one of those is the clinical determination, then we have a legal standing to be able to bring a case. And also, as Delia said, often children with these complex needs will be assigned a care coordinator with the MCO who can further help identify these service providers. Even if it's simply a list given to the parent and the parent calls, that still puts you miles ahead often of just, opening up Google and trying to find somebody on your own.
I'm gonna interject again. Sorry.
I'm supporting you, Delia. So you tell your story.
When you have a child that has developmental and behavioral health issues, such as my child, another issue that I've run into is that the people that are skilled at working with psychiatric care don't have a thorough understanding of autism and developmental issues. The people with developmental training don't have the psychiatric training. There's very little help for people with both, and a lot of misunderstanding, to the point where you'll even get some of the psychiatric professionals trying to push for that must be conduct disorder or something, because they don't understand autism. And I myself have worked with people with all sorts of different abilities, so I have an overview, which was helpful to me in seeing this is very similar to what I'm seeing in this group home that I've gone to visit and stuff. So it's even in inpatient care, it's important that both angles are addressed. So in a short-term psychiatric facility, like a 2-week, what have you, crisis care, if they don't have any background in autism, they're not going to handle your child properly. And so I've run into all sorts of difficulties with that dual diagnosis as well. And until I found someone that had some expertise with Disability Rights of North Carolina in that realm, I was really not understanding that part of things either. And now my biggest goal is to prevent any kind of care being forced on my child because someone doesn't understand one side or the other of his needs.
And Delia, I'll just support you further in saying, and I want to underscore for anyone listening, that there's, to your point, there is a conflation that is often made for the treatment that a child requires. And you spoke to it earlier, and that's, we hear a lot that the child needs a placement, blanket statement, placement. Under the Americans with Disabilities Act, there is a provision that makes it illegal to institutionalize a child or anyone if they can be successfully treated in the community and they want to be in the community. So we are required by law to look at what we call a least restrictive environment, which would be in the community. So in your son's case, that would be at home where he belongs and he wants to be and you want him. And we often hear that this need for a quote unquote residential placement. And I always encourage people to dig a little deeper and to say, okay, well, what are the identified services or treatments that you are, that's your opinion that this child needs? Because often once we dig in, we find that what's not required is not a 24-hour locked facility. Oftentimes in another state, because our state has a severe shortage of those placements, it is that they need robust services, they need wraparound services, they need intensive in-home services. All that can be delivered in the community. The issue that we run up against in North Carolina is that there just are not enough providers in the MCO networks. And so that is what really forces families to make the decision more often than not to place their child in residential care. It's not that the child cannot be served in the home. It's that the child, there's not services for the child in the home. And so I
have to interject again. Sorry.
Yes. No,
and that is that with the involvement of DJJ,
The
He was
Department of
also,
Juvenile Justice.
oh, sorry.
That's okay.
Um,
Just so people listening don't get lost in the acronym.
There's also a possibility that they can force my child into long-term care, or even remove my child from my custody to put my child into long-term care if they think that he's not doing well. So he's already been told and threatened by juvenile justice that if he gets any more charges, he may be facing long-term care and I won't have a say in it. That was
Right.
said to us by someone from the court. And I will also say, with all that being said, it sounds to me like they're trying to punish someone for having a mental health issue, and to threaten somebody, if you get in more trouble and you're going away to a hospital, that doesn't seem like the way things should be. It's
And that's
not
on the face
supposed
of
to
it,
be a
discrimination.
punishment. It's not
Yes.
a punishment to go to a hospital. It's for help. And even I found out at one point that one of the doctors was like, well, your child may even need juvenile detention or long-term care. I'm like, and even the attorney was like, well, what is it? Long-term care or detention? Does he need punishment or does he need help? Because it's not the same thing at all. And sadly, it's all enmeshed. And
Yes.
as a parent, I've had to really fight. I don't really know how it's going to end up. And I live in fear every time my child goes to school. And right now he's on an hour and a half school day. And I'm thrilled about that because I'm like, if he can't get through an hour and a half without trouble, then I don't know what I'm going to do. But, and he's happy about it too, because he's been so stressed out waiting for the shoe to drop. Like, oh, if I get in trouble today, I might get locked up. It's just not a way for a child to have to live. And he's only 13.
Right.
And he's got anxiety and all these other issues. And he's walking in the door of school every day, and they're watching him like a hawk, waiting for him to mess up. And I know this because I get all these reports of everything they're writing him up for. So I can say that juvenile justice has not helped our situation in any way. But one of the things juvenile justice will do is provide some of this care for your child. And then you lose the confidentiality of the therapy notes and things, because then they have full access to all of that if they're providing the services. That's my understanding, at least.
Yeah. And Delia, I'll just say, I know we're running up on time, but I just want to emphasize that this is the common scenario that presents to me at Disability Rights. I am in continual consultation with juvenile justice attorneys, with court counselors, with, helping to support them arguing in court that the child should not be placed in detention for mental health. And all of these systems really wrap and work together to mass dysfunction. You have a medical system, a school system, a juvenile justice system, a child welfare system. And unfortunately, more often than not, what we find is there's not enough awareness about the rights of the child to treatment and a context for understanding the behavior as disability, not willfulness or lack of discipline. And so I encourage, anyone who's listening to Delia right now, who's recognizing this scenario, to reach out to us at DRNC through our intake. Again, these are complex situations that involve multiple areas of law, and it's really challenging to try to tease it apart. But I just want to tell everybody that you're not alone in this. That this is unfortunately far too common, and I just really applaud Delia for coming forward today and sharing her story, because I know it's traumatic to live it, and I just support any parent that comes forward to share to make a difference.
Well, thank you both so much. It's 9:01, so I just want to be respectful of everyone's time if anyone needs to go right away. But I do want to give our speakers just one last chance to share any last thoughts or what they would like to leave people with. How have you figured out, what are some of the resources that you wish that you had Delia, like 5 years ago when this happened? Things that you know now that you wish you had known then that you can share with people who are in that situation?
Well, absolutely suggest anyone going through any of this gets a parent advocate immediately. If you then need legal assistance, the parent advocate will usually let you know that you need to call disability rights. You can go to disability rights directly, I think, but oftentimes there's some steps in between. I wish that I had known about the autism issues, but I didn't have that available to me. I also want people to know not to give up and not to let someone tell you that your child is a bad kid. One of the teachers at the school told my child he was a useless human. No child should ever hear that. I had a doctor try to tell me my child was just going to end up in prison. So I think if you hear something and it doesn't sound right, don't believe it, don't accept it, keep trying, find someone else that's willing to keep working with your child, and don't give up. And there's a lot more of us in it than you think. You're not alone.
Well, thank you so much. Again, we are a nonprofit, and so we accept donations to help keep conversations like this going and to help support our work as reporters to help families like Delia access the information about what's going on in their lives. That is often so difficult to find. So there is a link in the chat box where you can donate to help support our work. And thank you so much for joining us.
I gotta say, we didn't have any questions, but that was the most supportive chat I have ever seen on one of these, of just people sharing resources and commiserating. It was really sweet.
That's great.
Awesome.
I did see a lot of really kind statements from various people, and I appreciate that. I need to hear more of those because I've heard a lot of unkind statements, like the parking lot. If that was my kid.
Mm.
Those are the worst comments. I hate those.
Yeah, there's a lot of great stuff in the chat. So for us, there's story ideas too, because there were some resources I've never even seen before. So that's really great. I love it when people put stuff in the chat.
You know, I didn't even mention the fact that I've thought about quitting all my work, even divorcing my husband so that my child could stay on Medicaid.
Mm.
Even, you know, moving out of the home with my husband just so my child could stay on Medicaid, or moving to a state with better health care for mental health. You know, I've even looked into the top states for mental health care and considered moving to Minnesota or somewhere to try to help my kid. It's just
Minnesota is lovely about 4 months of the year.
Yeah, I think Delia, what you're saying is so true. I talked to so many families that it's exactly what you said. It really forces the fracture of families. The trauma of not getting the needed services. It's a huge stress on the family. And then once you do get the services, you don't want to lose the services. And of course, all of the incentives are perverse in terms of, you know, staying on Medicaid. You know, and then, you know, one thing I encounter a lot are parents who have adopted children who feel that their only option is to relinquish their children back to the state because they can't get the services they need. And that's devastating. It's truly devastating. So again, just thank you so much for sharing your story today. I saw a couple folks over at DRNC who were so proud of you when they saw the article come out. Because they know what you've gone through. And so, you know, we are 100%, you know, behind you. And like I said, you are absolutely not alone in this. It's an unfortunate club to be in, one to which I am also a member. But, you know, I say that it's not all bad, because we have these amazing kids who, you know, despite the challenges are also like incredible beings on this planet that we get to share our lives with. So
yeah, if only they could see my child in his sweet state and his, you know, loving, caring, beautiful side, which
yes.
isn't going to come out when he's under pressure.
No, rightfully so. When he's worried about being taken away from his home or in school or whatever, of course he's anxious. Of course he's, that's gonna promote, the behaviors. And so, to your point, I feel like, if we can be voices for better accommodations and greater understanding, we're really doing a lot to pave the path for not just the children, but adults who have lived with this in silence, for their whole lives. I've seen so many
Well-
adults come out, and understand themselves for the first time, and get diagnosed for the first time, like in their 30s and 40s, and it's life-changing.
Mhm.
One of my missions is to try to help other parents now, as much as I can, because I felt so alone so many times. It was, and even knowing that when you have a child like this, you can't get a babysitter. They can't go to after school. They can't go to kids' night out. They can't go with you to a lot of places. They can't do a lot of things that other kids can do. And even at 13, they can't stay home alone like a lot of kids. So people really do not, we're still broadcasting. I think we knew that. People do not realize that, it creates a